thank you so much for making it so early this morning. I caught Toby floating down the Rhine in his rye fronts as I was drinking my ginger shot. So we've had a really Swiss and waking up morning. So if we had an American audience, I'm sure Toby wouldn't need much of an introduction. But as we have a very international audience, I'd just like to start with getting a bit of a background as to who you are, what the Cleveland Clinic is, what your role was there, and also the fact that you are a patent queen with over 30 patents and having done over 22,000 operations. So a little bit of background about you would be a wonderful way to start.
Well, first of all, let me tell you how pleased I am to be here, because I think you have an enormous opportunity to influence in a very positive way healthcare going forward. I actually am a recovering heart surgeon, and after that I was lucky enough to become the CEO of the Cleveland Clinic for 13 years and stepped down about a year and a half ago. The Cleveland Clinic is a unique organization. We are about 62,000 caregivers across the world. We have 11 hospitals in Northeast Ohio, 5 in Florida, facilities in Abu Dhabi, and soon to be in London, with also facilities in Las Vegas and Toronto, Ontario. We're organized in a very unusual way, and I frankly don't know another hospital's organized quite like us. We're physician-led. We're not for profit. We have one-year contracts. In fact, I had 44 one-year contracts. We are salaried, and we have annual professional reviews. And I think those are really the defining things that have led to our success, because over the years, when I joined the Cleveland Clinic, it was 200 doctors, and now there are 4,200 physicians around the world. So we've had enormous growth over a period of time.
Amazing. So I suspect that if you've been the CEO of Cleveland Clinic since 2004, you're not hanging out at the job center afterwards. And I'm sure that you were inundated with lots of amazing opportunities. So given the fact that I'm sure you had the world to go and play with in terms of healthcare, why did you choose to then go and join Google as an executive advisor?
Yeah, very interesting. You know, so towards the end of my career, I realized that the explosion there was in knowledge in healthcare. And in fact, there are just a couple of examples. There are 5,300 medical journals putting out over 800,000 articles a year. The total amount of data in healthcare is now doubling every 73 days. And so we're absolutely just swimming in data. That's the problem. That's also the opportunity for us, because now if we can store this, if we then can retrieve it, if we can analyze it, that gives us an enormous opportunity to begin to learn new things that will improve our efficiency, will decrease costs, and improve quality, all things we're trying to do. So when the opportunity came along to do something with Google, I jumped at the opportunity, because I thought this is an opportunity to take two really divergent technologies, healthcare on the one hand and IT on the other, neither one of which really understood each other very well, and tried to make the match that I thought would be very useful for both of them. So I started out with Google Cloud, and increasingly the recognition is that for every hospital or healthcare system to have its own data center is really inefficient. I mean, what the heck do we all know about running data centers to start with? And so ultimately, I think most of this information is going to head towards the cloud, which to me represents an enormous opportunity to begin to get interoperability between the various cloud systems that there are, which we all agreed to share their patient information back and forth across them if it's with the permission of the patient. So that's one big opportunity. The other thing that I really see is the opportunity to take this enormous capabilities of AI and ML and begin to apply it to this huge amount of data that is being collected at a rapid rate. And I know that we're going to have unbelievable things that we did not even begin to imagine coming out of that. Just let me give you an example. The other day I was talking to the people at Optum, which is owned by United Healthcare, and they have 1 million patients with a diagnosis of aortic stenosis. They know if those patients have been operated on or they haven't been operated on. They know the costs, they know the results, and I am sure that by applying the techniques that we now have, we're going to figure out what the optimum time to intervene or not intervene in the patient with that diagnosis is going to be. And it will change the indications for surgical or medical intervention in those people. So this accumulation of data plus the capabilities of a company like Google or Microsoft or Amazon is an enormous opportunity.
So the kind of big companies up until this date have really been the health IT suppliers, the kind of electronic health record suppliers, and that's been what a big tech company has been in healthcare. And then there's the kind of the next phase of companies like the Amazon, Googles, Microsoft of this world that are now playing in healthcare. So where do you see companies like Google sitting in that infrastructure landscape? Because it's clearly not doing the roadworks of being the AMR anymore. It's kind of plonking on top.
Yeah, that's an interesting thing, because there's now been a discussion going on at many of these companies, IBM I know for sure, and Google for sure, have had the discussion about whether or not that they should do a new electronic medical record. And quite frankly, I think it is too late to do that, because across the world, and certainly across the United States, everybody has invested very heavily in their electronic medical record, both in the cost of the equipment and also the training of the people that do this. And for example, Partners just put in $1.5 billion invested in putting in Epic. So they're not going to just chuck it for a brand new electronic medical record. So what we're seeing now is the thought about how you make the electronic medical record better on top of that, and how you use the data that's coming out of the electronic medical record for making improvements in the delivery of care. So I think that we've gone past just going to the electronic medical record. We're now into, okay, how can we use the data that's associated with that in a significant way?
Yeah. So one of the biggest opportunities in AI is obviously identifying first and foremost what the biggest opportunities in healthcare are. And I've heard you speak a lot about the social determinants of health, and a lot of the work that the Cleveland Clinic did was kind of very, very deep wellness program within the community. Yet, when you look at most of the solutions being provided by big technology companies when it comes to AI, it's kind of hyper-specialized secondary, tertiary care. So how do you kind of reconcile the fact that you've got these really big companies with huge resources, compute power, skills, that are often working on actually not the biggest healthcare problems? So how do you marry those two up?
Well, it's interesting. The discussion with the companies has really been about where they should apply their capabilities. And I look at let's take Google, for example. They have over 40,000 engineers. And you can imagine if they could apply that brain power and capabilities and financial resources to, any individual problems, they've got enormous capabilities dealing with it. The real question is, what are the problems you're going to apply to? Google essentially Google Health has begun to come down and said, okay, how can we apply our basic capabilities to healthcare? And two of the things that they've really lit on is, one, we're really good at search. That is our strength. And so they've said in search, what we want to do is we want to improve the quality for patients to search around healthcare, and two, we want to help the physician use our capabilities for search for treatment and diagnosis. So that's one of the really big things that they've tackled. One of the other things that they're obviously looking at in a very hard way, as a lot of other people are too, is natural voice recognition, and how we make it easier for physicians to fill out all the paperwork or the electronic medical record that they have to. Right now, you spend almost twice as much time in administrative things as you do with clinical things, and so natural voice recognition would be enormous help there. Then there's a tremendous number of other smaller projects that they are looking at, and you can see them. Look at what DeepMind did in retinal scanning. Now making some 60 diagnoses on it. The amazing thing to me is they can also tell from your retinal scan your gender, your blood pressure, and your age. Incredible capabilities. So
just for people, if they don't know, and also because it's evolving organization. What is Google Health?
Well, what happens, there was a number of sections of Google. There was Verily, which is mailing devices, Calico, which is looking at drugs and looking at aging process. Then there was Cloud, which is now a huge portion of Google in terms of storing data. There was DeepMind, there was Brain and Brain Health, and several other things. And so what they tried to do is reorganize and put the significant portions of healthcare into what they call Google Health. And that took the portions from DeepMind, which were working on healthcare, things that were looking at brain and healthcare, and tried to put them together into what is now called Google Health, led by David Feinberg, who is a physician.
Simple. Everyone's understood that. Sorry, I'm just going to break the flow. Can we move a little bit forward so that Babita doesn't shout at me when I go over time, because I can't see the time, but we're just going to shimmy forwards.
Oh, okay. Thank you. There you go.
Thank you.
Well, that's a lot better.
I feel so much closer, more intimate. One thing that obviously you've been really promoting a lot is value in healthcare. So everything from the value of a kind of robust outcome for a patient to value-based payments. And value becomes like a slightly more interesting discussion when you think about AI, I think, for two reasons. So one is the value of the data if you are a provider, because you're sitting on this incredible wealth of data that you need to kind of extract the value, be it monetary, healthcare, the whole range. So one is, how did Cleveland Clinic see or view the value of its own data? What were the kind of discussions you were having around that? And two, how can AI help extract and enhance your whole value-based movement?
Yeah, one of the things that I've really been concerned about is the physicians, and I think this is true for physicians all over the place and hospital systems, think that they own the data. And they've been very reluctant, frankly, to share that data, and because they think it's proprietary to them and it has value to them. Frankly, we think that the opportunity is the sharing of the data, the using it in a collective fashion is going to be much more powerful than any one of us holding it in our own little sphere. So we are trying to have more and more collaboration across many, many organizations to do that. And it's difficult because the data that we need for looking at the social determinants of health are scattered all over the place. And we now recognize that the social determinants of health are way more important than what we do as physicians or healthcare providers.
Okay, so I'm going to push you a bit harder. So I'm creating, Maxine Inc., and I've got this incredible unicorn AI company because I took Cleveland Clinic data, made banging algorithms.
Of course it's a unicorn.
And of course it's a unicorn. And you know what? I am flying around the world in my private jet, and it's on the back of Cleveland Clinic's data, and you haven't seen a penny of it because we had a nice little sweet research project that I then exploited. Is that fair? Are you okay with that? How do you feel about that?
Well, that's a question, I guess let's take an even more important aspect of it. Who owns the data? Which is now, I think, that was really brought to the fore recently by 23andMe, who began to use that data and sell it to their genetic data and sell that to the pharmaceutical companies for very handsome profit. Thank you very much. So I think most people now think, and I know that certainly this is Google's stance on that, that the individual owns the data. Now, I think also you have to say that ownership of data is not something that you are going to profit from. It is rather something that you give permission to people to use. And so I think we can't use this data without permission that goes, and that is an enormous opportunity for society.
And maybe your back pocket.
I don't think it's going to be very much for their back pocket, to be honest with you.
So despite the fact that there could be enormous wealth in the broader sense of the term garnered from this, that's not the main priority. That's not something that the Cleveland Clinic, for example, would be looking as part of their business model.
Well, we'd certainly love to make money regardless of how we find it, as long as it's legal and ethical. Yeah. But I doubt that it's going to, over long term, be a major source of income.
So part of this is also wrapped in around kind of corporate transparency, and I know that you kind of really value transparency, did this physician's outcomes booklet to make sure that the outcomes of all the doctors was very clear and transparent, and that's a kind of very useful, concrete way to operationalize transparency. Meanwhile, you've got big technology companies that these kind of amorphous, opaque blobs that we kind of think we know what's going on inside, but we don't really know. And does that really matter now when we're marrying up these very, very big, powerful technology companies with big providers? So for you, what are the sort of the important things that big tech companies need to be transparent about when they're working with organizations like Cleveland Clinic? What really matters to patients for transparency?
Well, I think what would matter, well, first of all, let's go back to transparency. I think we believe in really radical transparency, and that's transparency within our organization and transparency outside of the organization.
Is this with a Cleveland Clinic hat or
This
Google?
is a Cleveland Clinic. Okay. And so, frankly, we're transparent with doctors about their results, and we give them in rank order by name what their results are, because it's very powerful in getting doctors' attention because they believe in data. Second thing we're really think is very important is the transparency that goes on around sharing our results across the bigger community, because we're a community resource and we think we owe it to the community. Now, I think that same thing can be applied across healthcare and across the organizations, the tech companies, which are going to be required increasingly to be transparent about how they get the data and how they use the data. And I think that's absolutely mandatory.
And so just our last kind of question before we open it up to the audience. So I hope you have at least one or two questions for Toby as he's with us. There's now a kind of a different scale of collaboration. Health systems are getting bigger and bigger. There are more groups of hospitals coming together, and certainly coming from the NHS, we're just one big organization. What can kind of big tech learn from big provider, and what can kind of big provider learn from big tech now?
Well, I think, first of all, it's gotten pretty clear that I think this individual standalone healthcare provider is rapidly becoming passé. And the reason is that healthcare has become so sophisticated and so team-oriented that you have to have collaboration, and you can't expect every hospital or to be all things to all people. Why should every hospital have to be putting pacemakers in people's brains for Parkinson's? Only a few places should do that. And so healthcare systems are coming together. Similarly, I think that you get a tremendous advantage from the size that goes on with a company like the size of Amazon or Google or something, because they have this enormous resources they can bring to bear. Now, on the other hand, I think the example you can see from pharma is they've learned to turn to startups like your unicorn that will wind up bringing new thoughts. And pharma basically buys its startups over time. I think you're going to see an enormous number of startups, and I've seen several of them, ones that are looking for, one I saw just the other day that is beginning to look at how they can do the billing autonomously for patients. And that's a startup and something that a company the size of Google doesn't want to touch. So I think there's a place for both the startups, and I think there's a place for the huge tech companies with their tremendous capabilities and things that they can bring to bear on really big, difficult problems. Interesting, I mean, just look at Google. There are 1 billion searches a day for Google. And it turns out that one of the biggest categories for search is healthcare. And they can find out enormous things from just looking at the results of who's searching for what, and on their search that relates to healthcare. For example, they can put a map out for the spread of flu, which is equivalent and more current than can the CDC in the United States that begins to get that data. They can also look for what building has a outbreak of flu. So there's enormous capabilities there in these huge tech companies and huge hospital systems, but there's also a very important place for startups that are going to add So I think your private jet is going to be in your immediate future.
That's very unmillennial of me to automatically presume I'm going to be on a private jet. I'm very sorry for that. So we've got time for one or two quick questions. So if there's a very efficient handout that. So maybe if we take two questions simultaneously, and then Babita won't aggressively stand next to me to tell me to wrap it up quickly. So question there, and there's a question over the lady just there.
Hi,
Go ahead.
Toby Cosgrove. I'm Ikram from Imperial College in London. I'm applying for residency in the US when I was in Cleveland Clinic with Dr. Griffin a couple months ago. I have a question. In your current position right now is Google. What do you make of the last couple days where Mayo Clinic and Google have partnered up in health analytics? Twofold. One, what are the opportunities, and what do you see, secondly, the risks for that?
The opportunities for startups, or well, so Mayo Clinic, as you probably may have read yesterday, signed up with Google and Google Cloud with a 10-year contract with Google. In truth, we're now having those same sorts of discussions with both Google and Microsoft as to whether we do the similar sort of thing. And I think that brings enormous opportunities for us to use their incredible capabilities, particularly around machine learning, and apply it to the data that we have. Just to give you an example, right now we're working with them on an autonomous way to read EEGs. I can't imagine, for example, being a neurologist and spending all day long looking at EEGs, to try and look for epilepsy. I think there is great capabilities to do that. I think obviously we don't think that we either have the capability or the potential to equal the capabilities that they bring. And so we really believe that you have to partner with tech companies in order to maximize the efficiency and get the most out of these capabilities of our data.
So our time is up, but I'd love to just take the question if we can be super speedy in the asking and the answering. Go ahead.
My question is about Google and the searches that happen. So there is a rumor out there that Google is censoring the data, that it's basically showing up in its search engines. So it starts to hide certain websites and prioritize others. So what is your opinion on that?
There is clearly a Chinese wall between the healthcare data and the commercial aspects of Google. And it is, if you looked at the cloud, for example, the extent that they go to separate those things is really pretty impressive. So I think it's probably more rumor than there is fact.
But if you'd like to know more, there is a social determinants of health panel at 10:10, and I think we'll all probably agree that most of that social determinants of health data is probably sitting in your Google search. So stick around for the 10:10 panel, because I reckon most of the meat will be in there. So thank you so much, Toby, for having us sit down with us, and stick around for the rest of the day. Enjoy the rest of the day. And Toby, will you be around?
I will.
You can mob him and ask him more controversial Google questions then. Brilliant. Thank you very much.
Thank you. Thanks.